I am Dr. Nasli R. Ichaporia. I am a neurologist and stroke specialist and at present Director of Neurology at Sahyadri Hospital, Nagar Road. Today I would like to talk to you about brain stroke and management of brain stroke, how to recognize it, and most important, how to prevent it. This is the most important thing for all of us to know, and is very well known. Brain stroke is almost as common as heart attack. Many people do not know about brain stroke because it is not publicized enough. Everyone knows about heart attack, but very few people know about brain stroke. But it is severely disabling and can also produce death and disability in patients. It's a fairly common disease, and 80% of patients, 80% of strokes can be prevented in the general public. So what I am going to talk to you today is how to prevent stroke. Many important lifetime methods are required to prevent stroke, and now we are seeing stroke in many young people. Previously, we used to see it in people who were in their 50s, 60s, 70s and 80s. But now we are seeing it in people who are in their 20s and 30s. And this is very frightening and alarming. And we have a large number of patients in their 20s and 30s. So what are the risk factors which can produce stroke? Most important is high blood pressure. Most people do not know that they have high blood pressure. So it's very important that you check your blood pressure regularly at all ages. At all ages. It's not that you have to check it after the age of 40 or 50. You should check it even in your 20s. And there are very good medicines to lower blood pressure, and you need to take them lifelong if you want to live a long and healthy life. Many people stop these medicines and therefore they get problems. So the most important thing now is blood pressure control. Second important thing is physical activity. Many people in India, large percent, are leading sedentary lives. They are not moving, they are not walking, they are not cycling, they are not playing games, they are not going out in the open. So physical activity of any form, whether it's walking, running, swimming, cycling, playing a game, playing a sport, is very important. Even as a child, if you were playing sports, it will give you lifelong benefit. And this benefit translates into years of good living. So playing sport or doing physical activity throughout your life, whether you are 20, 30, 40, 50, 60 or 80 also, it improves quality of life and it prevents heart attack and stroke. So this is very important. More than 80% of people in India do not do adequate physical activity. And now with the IT revolution, people are sitting in closed cabins. They are sitting for 8 to 10 hours in the day and not moving. They are sitting in air-conditioned rooms, not getting exposed to sunlight and eating the wrong foods. Then we come to diabetes. India is the diabetic capital of the world. It is because of our sedentary lifestyle and our not eating the right foods. Indian food is high in carbohydrate and less and is oily also, and less protein is there in our Indian food because many people are vegetarian, and many vegetarian diets do not have adequate protein and they have a lot of carbohydrate. So this increases the risk of diabetes in our population, and it has become an epidemic in India. Then diet. Many people are eating, as I told you, high carbohydrate food and eating fast food. Whether it's American fast food like pizza or burgers, or even Indian fast food like vada pav, misal pav, they are high in carbohydrate, high in fat, high in oil, and they are definitely very toxic. Another important thing is drinking all these cola drinks and sugary sodas like all these Limca and Sprite and Pepsi and this thing. So, we have seen now this epidemic of people drinking drinks like Sting and Red Bull. These are high in caffeine and they suddenly raise the blood pressure and can produce harm. So we have such beautiful Indian drinks and such beautiful Indian food. Indian drinks like Limbu Pani or Chas or coconut water. They are so highly refreshing and they are so nice to drink, and they really hydrate the body very well and do not produce toxicity. So I would request all of you to refrain from these sugary drinks and from Indian and American fast food. Eating a lot of green leafy vegetables and colored fruits of various colors, what we call the rainbow diet or a Mediterranean type diet. So we have an Indianized version of the Mediterranean diet, which is rich in fruits and vegetables and fish and low fat dairy. Dry fruits, also very, very good for health and to keep the brain in good shape. Excessive alcohol intake is also bad for the brain, and so is tobacco in any form. We find many young people now smoking, many young women are smoking more than men, and this has produced a large number of strokes in young people. So tobacco in any form, whether it is chewed, smoked, inhaled, the people in rural India using misri and rubbing their teeth with the tobacco, all of these are very harmful to the blood vessels of the brain and the heart. So kindly refrain from all these things. They are very easy. All this, what I'm telling you, does not cost anything. It does not cost anything. So this lifestyle is very important. Also to keep your weight under control. Excessive weight also is harmful, and excessively low weight is also harmful. And in India we have this concept of the thin fat man. The person looks thin but his fat content is high because his diet is not good, his protein intake is poor, a lot of carbohydrate and fat. So he looks thin but actually his fat content is high, and this is also a risk factor for stroke. There are other important risk factors. What we are finding in India is many people, large percentage of people are deficient in some vitamins and what we call micronutrients. Micronutrients like B12, vitamin D, iron and other trace elements, they are very low in the Indian population. So if you are vegetarian, we would advise you to take a vitamin supplement every day or every alternate day and keep your vitamin levels good, because this also is a risk factor for stroke and heart attack. So these are all very preventable, very easy things to do, but most people don't do them. Another important thing that we find nowadays is, instead of playing physical games, people are playing video games and looking at Instagram and seeing all those reels and sitting down for a long period of time. So sitting now is the new smoking. It is as dangerous as smoking cigarettes or using tobacco. So physical activity of any form is highly useful, and sitting for long periods, especially in the software industry, people are sitting looking at the screen for hours on end. Young people looking at WhatsApp and all these mobile games and things. It's a big problem. School kids are not playing physical games, using mobile games. So that is also very harmful in the long run. This also affects sleep, and getting 7 to 8 hours of uninterrupted restorative sleep is vital for good living. Most people are not sleeping. They're sleeping only 5 to 6 hours or even 4 hours and working late into the night because of various time zones. They have to work for America or Australia or UK. So they are sleeping late at night, getting up late in the morning or even in the afternoon. So this is also damaging the blood vessels and damaging the brain. So if you have a job like that, you are at little risk for stroke, because proper sleep is very important. So all these simple measures, if you do, your risk of stroke comes down by 70 to 80%. 70 to 80%, and these do not cost anything. There is no cost factor in this. It is very simple daily living practices which help you to prevent stroke. However, if you are unfortunate or your loved ones in the family is unfortunate to get a stroke, you should immediately come to a hospital which treats stroke, not to nearby Shejarchi hospital. Many people go to a gynec hospital or a orthopedic hospital. They don't know how to treat brain attack. So you must come to a hospital which treats stroke. So how do you recognize stroke? So if you get sudden headache, if you get paralysis, weakness on one side of the body or both sides of the body, or tingling sensation, or vision disturbance in any eye, or facial droop, immediately drop everything and come to the hospital, because time is very important. The more time you waste, the less brain substance you will have, and it can produce severe and permanent damage. So if treatment is given in time, quickly, in a good hospital, your brain cells can be saved and you can lead again a normal life. We have umpteen number of patients who have come in time, and we have systems in our hospital to treat stroke urgently and expeditiously, and people have gone back to normal living. But if you come late, if you're far away, if you're sleeping alone at night and nobody knows till the morning, then it produces brain damage, and then there can be permanent disability and even death. So time is of the essence. So we formed many words like this now. Time is brain. The more time you waste, the less brain you have. And everyone wants more brain, because the more brain you have, the better is your quality of life. Another very important thing for prevention and good living is to prevent anxiety and depression. Now, depression is becoming very common in our city and in India because of various stressors of daily life, and even without stressors. So treatment of depression, treatment of anxiety will also improve your quality of life and help you to live better. So our aim in life is first to prevent stroke by using these lifestyle simple measures, like as I said, control of blood pressure, control of diabetes, physical activity, no smoking, eating the right food, living a good life, happy life, without depression, without anxiety. But if you get a stroke, if you are unfortunate to get a stroke, come quickly to the hospital, and to a hospital which treats stroke, not any hospital, and take treatment quickly. So this is the message I want to give you. Thank you so much.